I want to start with something that sounds very arrogant, and I hope it is not read this way. I want to create a hairline for you that is really non-negotiable. So what does that mean? So when I draw a hairline for you, out of over 20 years of experience, I know this hairline will work for you. A natural question, people say, well, can I show you my old hairline? No. Because to draw a hairline, I factor in so many things to create you a powerful aesthetic result and one that will age well for you. So my friend out of Brazil, Mauro Speranzini, actually did a really interesting study. He gave men a pencil and said, you draw the hairline in. And almost all of them drew a transgender hairline in. They did a prepubescent male hairline, which is a curved hairline. They don't know better. And you know what I see? A colleague of mine who's a very good facial plastic surgeon, I actually messaged him. I said, I know you're starting hair, but you drew a female hairline on a guy. You need to come to my course in St. Louis. I'm not trying to make more money on him because I don't make my money on my books or my courses. But he doesn't do hair. He doesn't know it's fake. And that's the problem, is when I give you a pencil or you think this is what I need a blunted hairline, this is a female design. So the side angle has to be here or go up. It cannot be tilted down or it doesn't look right. And the hairline has to balance the temple. So if your hairline sits way out here and your temple sits back here, it's not going to look right. It looks like a hairpiece or hair system. And an example I've told a lot about is a couple of years ago, I was on a cruise and a guy had a hairpiece. He had some bad temple transplants. My parents and my wife couldn't tell that was done. I could tell from a mile away it wasn't looking right. Why? Because I do this for a living. So my standard is going to be much higher than yours. I want it to look right for you. The other component that's in my head is how it's going to age for you. So a lot of times if your donor is more limited, I can't do a more aggressive hairline. Or if you're very young, the younger male is the one that wants an incredibly aggressive hairline. I had a 27-year-old that came to me and said, Dr. Lamb, I don't care what I look like at 40, just make me a great hairline so I can be socially appropriate. I told him, no, you cannot have surgery. You're too young, and that hairline won't age well for you. You're going to have a disaster. And I've had a guy in his 40s that said, Dr. Lamb, I wish someone just told me in my 30s never to get a transplant. And I tell patients all the time, don't do a transplant if I feel they're unsafe. So when I draw that hairline, I'm not only factoring, will it look good for your ethnicity, your gender, and your facial shape, I'm also wondering, is it going to age well for you? Am I going to have enough grafts to fix future problems? Am I going to force you to do 3 to 4 more surgeries when you really should only need 1 or 2 more, or maybe not even 1 for another decade? Because that donor hair is so precious. And I encourage you to watch my recent video log or podcast on donor preservation, because that is a huge factor. How do you know what donor you have? The first thing I do when I walk in a room is I look at the donor. When I teach in St. Louis how to do hairline design, first we got to follow all the rules, and that's part of the rules that I introduced. If you violate all the rules, it's not going to look right. And I'm sorry, I'm going to jump in and make that aside. I saw, I mentioned this in a recent podcast where someone said that, this guy, he went to Turkey, had a hairline that changed his life. It should probably change his life because it looks ridiculous, and he doesn't even know it looks ridiculous because his hairline goes past the lateral canthus. It looks scary. So you don't even know what looks fake out there. It looks too straight. It looks insane. So when I define that hairline for you, I'm defining it based on donor density, age, all these components. So to finish my comment is, when I teach in St. Louis, part of my didactic teaching is, first, let's follow the rules. Let's get the hairline to not violate any rules of hairline design. Doesn't tilt down, the temple and the hairline balance each other. But then the next level sophisticated comment is, let's see, does it fit this patient? And that's the thing that I try to get in, because it's so important that I teach that to my students. So I look at, what is donor capacity? Are there areas of miniaturization that could be a problem in 5 to 10 years? What is the patient's age? What is that patient on medical therapy? What are problems that are going to happen in 5 to 10 years? How can we minimize and avoid it? All of those factors come into play when it comes into a hairline. The final thing I want to talk about is, in terms of negotiating hairlines, this is what's interesting. In general, this is a blanket statement, it doesn't apply to everyone, but in general, the younger the patient is, the more aggressive they want that hairline, and the older the patient is, the more scared that I'm overdoing it and they want a more conservative hairline. You know what's interesting? It should be the exact opposite. The younger patient needs a more conservative hairline, the older patient can have a more aggressive hairline. In general, because the older patient, I know how it's going to age for them. The younger patient, I'm scared to do aggressive hairline because it's not going to look right. If that temple falls back from that hairline, we're going to be in trouble maybe in 5 to 10 years. So I actually oftentimes will design a more conservative hairline in a younger patient. The older you get, the more aggressive I can be with that hairline. But the reason why the younger patient wants a more aggressive hairline is that that patient is seeing their peers having these straight hairlines thinking that's what I want. So they want something that's unrealistic, that's dangerous. And that's what I don't offer that patient because of safety. The older patient is doing two things. One is they're looking at their peers saying, hey, they have a really conservative hairline. And I'm not saying I'm going to create this ridiculous hairline for them. I still create a hairline that's appropriate for the age and degree of recession, donor density, and all those factors. But I could do a little less suppression for them. But they're afraid oftentimes of looking too different, that they were going to be spotted out. What's really interesting with hairlines is that I can do a hairline and have a guy, I remember the guy recently I did a second transplant, 12, 13 years after his first transplant, he came to me slick bald and he had nothing on his head, and he's a physician. No one knew he had it done. Like, I take humps off noses, people don't even know I had it done. That's the beautiful thing of good hair transplants. And the reason why you say, well, how could someone look at a bald guy and all of a sudden has full head of hair, not see that? The reason is that hairs don't come in like this in a day. They slowly grow in. So people forget what that used to look like. And so because the hairline looks so natural, people forget. So I need the hairline low enough that it actually provides an aesthetic frame that's powerful for you, that looks good, makes you look better. Otherwise, there's no point to the hair transplant. But I need the hairline conservative enough that it will fit your frame, fit your ethnicity, fit your gender, and age well for you, and not have donor issues in the future. So when I draw a hairline for you, those are all the million factors of 20 years of experience going into the design. It's not like I'm telling you, hey, I'm a dictator, I don't care about your old photos, this is what I need to do. I'm doing it for your safety, and I'm doing it for your aesthetic benefit.